It is a love affair because it's never changing. So for someone who needs variety and stimulation, I have it. People to me are so unique and different that I get that sense of stimulation and variety from the different stories and cases. Also, people are unique in how they respond to treatment. So I don't use a one-size-fits-all method. I have to be able to be flexible. I have to look at myself also and what I do to contribute their health or being stuck. I don't blame the client for not getting better.
Yeah.
Nor do I blame myself. I don't. I think it's a synergy between the two that contributes to their progress.
Mm-hmm. Just one sec. Just back there. So, what is sex addiction?
Well, that's a good question too, because it's not in the DSM-4.
Yeah.
I would rather call it an intimacy disorder that has the symptoms of compulsive sexuality.
Mm-hmm.
Because at the end of the day, that's what we're dealing with, is the problems with intimacy. And like any addiction, it has the components of denial. I don't have a problem, or I can handle it, or it's just not happening, or I can quit anytime. It has those components. It has the background of shame as a root of some of it. A person with self-loathing and doesn't feel good about themselves on some level, that feels that their needs will never be met any other way. And
Right.
for them, sex is a need. And it's an attempt to get needs met in a kind of a sad way. And not everyone that acts out sexually is a sex addict.
Mm-hmm.
It really depends on why they're doing it, how it affects their lives, and what happens when they try to do something different. So,
I interviewed this woman who wrote a book about love addiction. I once dated someone who'd been diagnosed as a love addict, and it strikes me, knowing almost nothing about the topic, that women seem much more susceptible to love addiction and men to sex addiction, but it's a kind of a similar rush thing.
yeah. If you, I guess the love addiction is an addiction to romance, but the similarity is the two are addicted to fantasy, not
Yeah.
reality.
Yeah.
And I really don't see much difference between the two of them.
Yeah.
They're both very painful to the person that has it and to the people they get involved with. And they're both in denial of what's really happening.
I was talking to a young woman the other day who's like, beautiful, accomplished, educated, seems everything going. And she's talking about how much she loves romance and how much she loves being in love, and she says it's like a drug. And when I was hearing that
being
talk,
in love is a form of insanity.
Yeah.
Helen Fisher wrote about it. The chemicals the brain and the body produce is high, and the way a person acts is a bit nutty
yeah,
during that time. And people get out of themselves for that short duration, and of course it doesn't last forever unless the person finds themselves in a push-pull relationship where that gets reactivated, where they push each other away, and then there's this yearning that comes back, and this rush of the reunion, and it goes back and forth and back and forth. That can go on forever until people get really sick physically as well as mentally. So yeah, it's the love addiction, if you want to call it that, is I don't see it as much different.
yeah. When I heard this woman talk about being in love is like a drug and how much she loves it, I was just thinking that chasing that high could very well lead one into trouble.
Yeah, well, I don't know anyone who doesn't like the feeling of being in love.
Right.
And I don't know anyone who will say that it always feels great. There's a bit of agony that's involved with being in love as much as... So there's pain involved with it because of the anxiety it produces and the yearning, and it's not necessarily a comfortable feeling for everybody all the time. But it is a distraction from what that person was experiencing before. If a person has an emptiness or identity issue, they don't know who they are, or they're not sure where they're going in life, falling in love is a much better option than feeling that. I mean, it's the reason why people do what they do, even if it gets them in trouble. The reason is not illogical. A person wants to feel better, period.
Yeah.
So there's nothing wrong with that logic. The problem is the choices made to feel better are bandages and not really solving the problem.
What are some questions that you would ask if you suspected that a patient was a sex addict?
Well, generally they come to me already telling me that they are.
Yeah.
And there's no need to have the question, because by the time they come to me and come to their own conclusion that they are, we don't need to go through the 20 questions. And there's a lot of questions on the internet, sexhelp.com, that Patrick Carnes site. Essentially, it shows a loss of control, consequences to the behavior, yet continuing the behavior, those types of things. It's almost like the same criteria one would have for alcoholism. How do you define someone's drinking to be alcoholic?
Yeah.
Well, when they have a problem with it. And they'll tell you they don't have a problem with it, but maybe the people next to them have a problem with them with it. Or their liver has a problem with it. At some point, it becomes a problem. So they may very well be addicted to something and deny that they are until the consequences make it painfully clear that they have a problem.
I'd suspect, unless you're a rock star or an actor, for most men, sex addiction is really masturbation addiction.
Well, yes and no. I have worked with people that really don't spend much time at all with masturbation and have no interest in it because they don't have... their thing is touch. They want to be with a person. And so being by themselves only makes them feel more lonely. I have other clients that never stray from, say, their primary relationship, but they are absolutely hooked on the computer to pornography.
Yeah.
And so on and so forth. So all relationships suffer when there's a third party involved. And whether the third party is another person, the internet, overwork, whatever it is, they start having problems in their relationship.
So a friend of mine got married, and a few months in I said, so how is it? And he says, oh, it sucks, man, I can't look at porn anymore. My wife, really objects to my looking at porn. So you said if there's a third party involved, the relationship will always suffer. So does use of pornography while you're in a relationship, is it always detrimental to the relationship?
No, it really depends on a couple of things. First of all, is the partner okay with it?
Yeah.
Okay, if she's not okay with it and it makes her feel badly, it deserves a serious discussion and either a compromise or a decision that, the relationship is worth giving the porn up for. A lot of women do object to it. Another option is, we can only look at porn if we look at it together. It really depends on the partner's view on what's upsetting to them.
So if porn brings people closer together by sharing their fantasies, then it's not necessarily deleterious.
Not necessarily. However, if that is the only way that the couple can manage to be interested in each other, then I would say there's another problem also for both of them.
Yeah.
Like anything else, like food, if a person has a cheesecake every once in a while, and enjoys it, that's one thing. But if they need the cheesecake after every meal, or you know,